So let's move on to our last speaker, Umaymah Mohammad. Umaymah is a Palestinian Egyptian MD PhD candidate at Emory University in Georgia, pursuing a PhD in sociology. She has spent years organizing to resist state-sanctioned anti-Muslim racism, the unlawful surveillance of Black, brown communities, and the colonization of Palestine.
Hello, everyone.
Excuse me, Umaymah, could you mute first? Let me finish in her research, she explores questions such as how have radical communities of color interacted with medicine and healthcare professionals? What does it mean to abolish structures of violence like prisons as a form of healthcare? And what is the role of the physician or healthcare worker in addressing structural violence such as capitalism, colonization, racism, and poverty? So go ahead, Umaymah.
Thank you for the introduction. I'm so excited to be here with this amazing panel of student and organizers who have been part of this international liberation movement. With my short time here today, I'm going to be talking specifically about medicine as a component of a scientific discipline that has been complicit in these systems of violence, and how students and healthcare workers have been, especially in this last year, resisting this complicity in their positions in the healthcare field. So I have a picture here just to get us started of a vigil done by healthcare workers for Palestine in New York that was organized by medical students. And I believe this is a visual of the over 1,000 healthcare workers that have been killed by Israeli US bombs in the last year. So I thought we could start off just by thinking about why it's important to resist in healthcare spaces. Why is this an important site to disrupt and to speak up? So I'm speaking specifically from a US and Western perspective, you know, in the sense that healthcare institutions have a long history of being complicit in structural violence, both against local and international communities. You know, in the US, the healthcare and medical systems have been an integral part of upholding our systems of racial colonial capitalism, of scientific racism, and even today, these systems are still upholding these harmful narratives. Similarly, in Israel, physicians and medical students and healthcare staff are participating in enforcing the settler colonial project. There are so many examples of this. You know, even just in this last year, we saw that an open letter by over 100 Israeli physicians calling for Gaza's hospitals to be bombed. We've also seen plenty of reports in the last year of Israeli physicians participating in the torture of Palestinian civilians. And this is a long recorded phenomenon in Israel, actually, that's been recorded by Physicians for Human Rights and other international human rights agencies. So thinking about all of these levels of complicity in medicine is what makes it an important site to disrupt, especially here in the West. And I have just a few other examples of what this has looked like in the US and Israel. So there are entire disciplines in medicine that were formulated based on the experimentation of procedures on enslaved Black and brown people. And these things still remain today, and they're based on these harmful narratives about Black and brown bodies. And these things have continued into the present. So, you know, I have an example here of Fannie Lou Hamer, who was forcibly sterilized in 1961 by a physician. And there is an enduring legacy of physicians here in the US still practicing this level of eugenics. Just a few years ago here in Georgia, there have been allegations of physicians at migrant detention centers forcibly sterilizing migrant women. So these enduring legacies of eugenics and scientific racism and biological racism and racial colonial capitalism still define healthcare institutions here in the West. And of course, another example from Israel, this is in 2013, a big story broke that it was found that Israeli physicians had forcibly sterilized thousands of Ethiopian Jewish women in Israel as a form of population control. Again, this is to reiterate the importance of resisting in healthcare and medical spaces, because these systems and these personnel have upheld, these settler colonial practices, and they do still today. Just some more overview of how U.S. healthcare systems are involved in Palestine. Just like Emory University and other healthcare institutions, they often have ties to Israeli universities, which are existing illegally on stolen Palestinian land. Israel often holds scientific and medical conferences that are attended by U.S. physicians and medical faculty and personnel. And it's not uncommon to see your local faculty and professors attending these conferences. At Emory University and other institutions here in the US, there are physicians who have served in the IDF. And in fact, a physician at Emory has actually volunteered to serve in both a medical and military capacity in this last year in the genocide. And these physicians return to teach medical students and see patients. And so our institutions are literally employing people who are not just complicit in these genocides, but their hands are directly participating in the taking of life. And in fact, this is such a this simple, like, individual example is a reflection of a system that chooses which lives to save with one hand and which lives to take with the other. Again, just reiterating the importance of dissent and resistance in healthcare and medical spaces. And I thought it's important to note, we've been seeing these recent documentations of organ theft by Israelis of Palestinian organs in the last year, but this is also a documented phenomenon that's been going on for a long time. And I have a quote here from a well-known anthropologist from 2009, Nancy Shepherd Hughes, about organ theft, and she says, their Palestinian organs were taken without consent of families and were used to serve the needs of the Israeli country. And the people who did the harvesting were sent by the military, and they were often medical students. Again, so thinking about the ways in which our healthcare personnel and students are actually upholding these harmful, racist, colonial, capitalist systems. So moving on to the way that US healthcare has been responding to people talking about Palestine, students, faculty, sort of across the board, we've seen over and over again healthcare systems and schools punishing routinely students and healthcare personnel for talking about Palestine. And this has looked like disciplinary hearings, firing physicians, sort of, putting sanctions on these people. I have a few examples here of a nurse who was forced to quit because she wore a Free Palestine badge. Dr. Yapongji has sort of gained a pretty strong international following, but he was a fourth-year resident at the University of Ottawa who was suspended for talking about Palestine. He was eventually reinstated, and he actually left the institution. And I have a little clip here of myself, actually. I am currently going through a disciplinary procedure at my school for talking about the unlawfulness of physicians serving in militaries that are on trial for genocide. And then these physicians returning to teach medical students and see patients in our communities. And so this is characterizing what it is like to be a healthcare student or a healthcare worker these days, talking about Palestine in defense of life and against these systems and violence that are taking life on a massive scale. Of course, healthcare systems and institutions are also pushing this harmful two sides narrative if they're even addressing the genocide, legitimizing Zionism, legitimizing settler colonial violence. And they're very powerful in doing so, unfortunately, under the guise of, healthcare. So moving on to how healthcare students and workers have been resisting, I have sort of three general examples of what this has looked like. In the last year, an organization called Healthcare Workers for Palestine has come together, and it's a coalition of different types of care providers and students who are denouncing the Israeli settler colonial regime and the US involvement in that settler colonial regime. They have constantly organize protests and vigils and rallies and talks and speeches to provide that counter narrative in healthcare spaces. Another important way that students and healthcare workers have been resisting is at the encampment. So at Emory University and at other institutions, medical students have actually bared the brunt of setting up the first aid tents and staffing those first aid tents to be first responders to police and settler violence. At Emory, I'm sure most folks here saw the crackdown at our institution. It was a very violent crackdown of the police at the encampment that led over the arrest of 20 students and faculty. People were tased and tear gassed and assaulted. And as a response, medical students at our institution set up a first aid tent at the encampment and staffed it every day for weeks. So that's one way that people are actually using their skills to dissent and resist, even in the face of sort of a hostile administration. And then, of course, we've been seeing hundreds of healthcare personnel, nurses and physicians and physiotherapists go to Gaza and volunteer their skills to literally protect the life of Gazans and Palestinians who are suffering under Israeli bombardment. So I kind of wanted to end by thinking about what the healthcare workers of Palestine and Gaza have to teach us as healthcare students and care students and professionals in this field. You know, the physicians of Gaza will talk about the level of care in Gaza. You know, that physicians in Palestine are considered like the revolutionary class and the moral compass of their society, which is so antithetical to the way that healthcare in the US is conceptualized, considering it's literally one of the arms of racial colonial capitalism. And so we have so much to learn really from the guidance of these care workers in Palestine. These are just three of so many examples we can look to. But Dr. Hammam Allo, I'm sure some of you are familiar with this physician. He was interviewed on Democracy Now! Maybe 2 weeks before he was killed. He's a Palestinian nephrologist that was killed last November in the bombing of Al-Shifa Hospital. And in his interview, Amy Goodman asks him, why don't you evacuate when Israeli soldiers told you they would bomb this hospital? And he goes on to talk about why he went to medical school and why he invested so much in his training, that he's here to protect life. And he, rather than evacuating with the patients who could leave and the physicians who could leave, stayed behind to take care of the patients who were not able to evacuate. And he died alongside them and cared for them till their very last breath. That is the level of care and the protection and the sanctity of life that physicians in Palestine carry for each other. And for me is a genuine guiding light in the way that I see my care practice and resistance here in the US. Another example that we've just seen in the last few days with the siege of the north of Gaza is Dr. Hussam Abu Sofia, who's the director of Kamal Adwan Hospital. Here you can see in this picture taken 5 or 6 days ago, he's praying in his white coat over the body of his son who was killed by live Israeli ammunition because they're targeting healthcare workers and their families. And these physicians will literally bury their children and continue to work to protect life. That is the resilience and the steadfastness of the physicians and care workers in Palestine, again, that serve as a guidance to us here as students and in the international care field about how we move forward through this. So those are just 2 examples I want us to think about. And I just want to conclude here with some final reflections that it is important for us as care workers, healthcare students and professionals, not just to exercise the power to save lives with our hands, but the power to save life by dismantling the structures that take life on a massive scale. And that starts with changing the culture and changing the narrative. It's very important that we're speaking out in these healthcare and care institutions despite the pushback. And again, just to reiterate in a different way, it is truly our professional duty as scientists and physicians and healthcare workers to dismantle the structures that are taking life on such a massive scale, like the State of Israel, like the IDF, like the US empire. I hope that you all found this framework generative and important, and I look forward to hearing your questions. Thank you so much for your time.
Thank you so much, Umaymah, for explaining how Western medicine and Israeli medicine are complicit in the ongoing genocide, as well as in the continuation of eugenicist policies in the United States and elsewhere, and also presenting this alternative view of what healthcare could be like, and that people like you are struggling to create and support. So I think we have time for a question for Umaymah before we go to the general discussion. Here's one. How is this information disseminated to student populations and the general public? So how do you get the word out, Umaymah, about what you're doing?
That's a great question. With the level of repression that exists in our healthcare institutions, it's actually quite difficult to get this counter narrative out. And because there's a lot of retaliation as a student in these care fields, it creates a culture of fear for students who want to talk about this, to actually talk about it at these sites, at their medical schools. The way that folks have sort of shared this information as well, I mean, I've shared this information on my medical school listserv, but it actually led them to shut down the listservs on the entire campus because they didn't want students to share this information about this genocide. And that's just to give a picture at how difficult they're even making it to spread this information. But people are creative. Like yesterday, I actually did a teach-in openly on the quad, and we had a mic, and we just did a public teach-in on the lawn on campus about this exact phenomenon. And people are being creative about how we disseminate this information through zine making and stickering, by organizing outside of healthcare institutions. And so it is difficult, you're right. But it is our responsibility to be as creative as possible to get this information out.